All right, welcome back. It's Dr. Stephen Newhart with Vigor Active Health Chats. Thanks for joining us again. If you watched the interview that my wife did of me, I was kind of priming us for this talk that we're having today. So I have with me a doctor of osteopathy, and she is a pain specialist, and she's doing something just a little bit different, but I think it's going to have a really big impact. So if you would join me in welcoming Dr. Nikki Fox. Dr. Fox, thanks for being here.
Thanks for having me.
And it's good to see you. I know we see each other quite a bit lately, and I'll just throw that out there to start because we're kind of working on this project together. But we can talk about the project while we're here. But the more important thing, I want to learn about you. I'm going to ask you 3 questions real quick, and we'll address all of them as we go. And then I'm going to shut my mouth and let you go. Your background, how there's with people like yourself, you're a wonderful doctor, and I need you to know that. And I've told you that once or twice, but I'll tell you again right now so that everybody else can hear, because I know that you are. And one of the bigger things, you keep yourself in great shape. I think that's huge. You're going to be very cognitive, and I love that. I love that about you. And so thank you for being who you are. But usually you're shaped. People get shaped in some way by their past. And I want to hear about your past and how you got to that point. What was growing up like, any sports you played, and then obviously you went off to school and something drove that. So you kind of go into the backstory for us. I'm very curious.
Yeah. Well, first off, thank you very much. I'm probably super red in the face right now, but I appreciate all the accolades there. I've always been an athlete, pretty much coming out of the womb.
Okay.
So into grade school, gymnastics, even played a stint of baseball.
Oh, awesome.
Of course, getting into high school, continued on with sports in Eastern Oklahoma. I played basketball, believe it or not, golf.
Golfer.
Yeah, I was a big golfer. But then in my late teens, I got into working out in the gym with a close friend of mine. He was a gymnast and actually my best friend growing up.
Okay.
And we just found that I had the physique for weightlifting and
type 2 muscle fibers.
Lots of type 2 muscle fibers, right? So
yeah. It's the good formula.
And I just loved it. I fell in love with the gym, trained very consistently. Didn't do a lot for my golf game at that point in time because I just didn't know how to make that connection.
Yeah.
So anyway, got into college and right into bodybuilding. Just was at the gym one day and was noticed by someone who had an actual team and joined their team and
awesome. So a bodybuilding career, essentially.
Yeah.
Through college.
College.
And then out of college. Did that go into, quick, where'd you go to college?
I actually started out at UCO and then went into my master's program at Oklahoma University.
Okay. And master's then goes to
med school.
Okay. Yeah. So did you bodybuild into med school as well?
Actually, I retired, I would say just before I went to med school, maybe 6 to 8 months prior to.
Okay.
So I just hung it up.
It's a lot, right?
It was a lot. I just hung it up. It's a lot.
To go through a doctorate program and try to do that at the same time. It may have been a lot.
Yeah.
So what's a medical degree like? Tell us what
It's a lot of solitude for a period of time, for at least 2 years. Sure. You're pretty well locked into study mode 24/7, 365. That was very difficult. I missed a lot of family time, family events and so forth. But ultimately the end goal to come out and do something wonderful for people, it just, it makes up for all that.
That's what I've heard. And you told me that before. You're saying, hey, I wanted to help people. And that's why I love being by your side, essentially, in some form or fashion now, because I've always said the same thing to myself. How I'd get there, I don't know. I mean, I think I found that health is a great way to help people, because when you're not in good health, it's not fun.
Yeah.
Okay. So, but I love hearing that. And I guess that maybe the driving force. Hey, I want to do something different. I want to help people.
Yeah. I think with my bodybuilding history and then going into med school, I chose physical medicine and rehab as my residency, which was very broad.
Awesome.
But musculoskeletal obviously was the part that I latched onto. And then interventional pain as my fellowship, because I thought, well, I can get some people time in the clinic setting and then some OR time with actual procedures that are, invasive to help people and combine the two. So,
And you do now, right?
and I do now.
That's what you
I
do
do now.
Yeah.
But the exciting thing is what we are now reaching into
Sure.
with the involvement of the EEGs in order to see those brainwave patterns and what areas of the cortex are firing, and then moving into neurofeedback to maybe help produce some signals where firing they should be firing.
That's exactly. Well, I'm just going to step out because you got it all down, and you can just. I love that. I love hearing that. I couldn't put it any better. We do have. So let's look at this real quick, if you want to. We've got some things we can put up here.
Mm-hmm.
I want to start. So if anybody out there is curious, you can go to the interview my wife does on me, and I'll talk about brainwave patterning and stuff like that. But what we've got here, let's just pull up. Let's just say the first one. Let's look at a pain. Let's look at a pain. So this is a traditional pain, I think. So this is actually the colors are a little more elaborate, but we'll see what that looks like. So what you see in pain, and you and I have talked about this before, you're going to have high levels of theta, which actually that is high. The coloring is a little off on this. You're going to have high levels of theta. There's a lot right there. And then you're going to match that simultaneously with high levels of beta and high beta. Okay. Now I've seen some where this is completely red. This is all red. Mm-hmm. This person may have some pain, but it's probably not completely agonizing. Now, going back, that's the important part. Theta combined with beta and high beta. So now we know what biological pain looks like, right, in the brain.
Right.
And we've been studying this. Mm-hmm. Now, this is always a common story because people hopefully have heard me talk about brainwaves. When you have delta being high, that means that you're feeling a little sad. Mm-hmm. I think if you're in chronic pain, you're probably going to feel a little sad. So this may present as a little bit of depression. So when you have these pain brainwaves, you're having brainwaves over here that are like, I'm feeling a little bit. Now, we'll talk about this before we go on to the next one. These the incoherences, we'll call them incoherences, that we're seeing right here in the central part of the brain. You've showed me some anatomy graphs of the brain, and the pain centers live somewhat right around there, which I'm seeing this in all of them. Okay. So we're getting lack of coherence in these areas, which also could be either the brain's presentation of that biological pain or, this dysfunction could be causing it. We know that. So anyway, but this is what we see when we see real pain. Mm-hmm. So now we have an anxiety graph. Mm-hmm. We have a depression graph. We have ADHD. So those are all going to be psychosomatic. If somebody's got pain and they have those other abnormalities, maybe it's going to be due to that instead of an
actual centralization of pain.
Centralization.
And we'll be able to tell that through this mapping.
If we go on to the next one here, see what we see. This is really, really high theta. So before we were talking about the combination of three, this is like, I got a little bit of delta going on, but my theta is off the chart. It's just actually the same type of dysfunction happening here. This person who knows what they have. But this is typically low brain oxygen. Okay, so maybe we see this in people that don't exercise a lot. Or, as I was saying, learning disorders, ADHD. Sometimes it's memory, but that's that, right? So a person that has specifically that, if somebody comes in and they have this, yet they're saying, I feel pain, I'm going to link it to this dysfunction that's happening here, which is the hypocoherence, or I'm going to link it to the fact that you have a whole lot of theta waves. Now, as crazy as I've never told you this before, we'll just kind of do it right here. Okay. Theta is a person disassociating. If you use a disassociation, kind of like, because that's present a lot when people daydream. Like, I really think I'm on the beach right now. You know what I mean?
Yeah.
But you're awake. You're somewhere else. You're not in your body. You're in your body on the beach. That's, and you might care about this. All these kids that are on social media and stuff, we're seeing a ton of that.
Interesting.
I
find that fascinating.
When they have a dysfunction, that's what we're seeing. The next one that we go on to, let's see what we have. This is anxiety. Okay. Anxious people often feel pain, psychosomatic pain. And then the next one that we have is, I think, a possible depression plus anxiety, because we've got the depression here. I believe this was actually a depressed patient from one of our psychiatry clinics, so depression, and they had a little bit of yellowing going on here, so maybe they were feeling some anxiety from that. But it's pretty clear. So the way that we're looking at it, we also now have a graph of an improvement that we made from the exact same program we're doing together, right? But I mean, it's just so interesting that we can now see pain patterning, and then we have all the other, which I think we're just going to call psychosomatic, and like you said, fix it with the neural feedback.
Right. Right. Absolutely.
So tissue damage. If we've got real biological, we have vibration. It's very interesting.
Yeah.
What made you so forward thinking to actually put this program in?
I felt that we had just stagnated a bit in the field.
Sure.
We've got, spinal cord stimulator is excellent as far as basically stopping, or not stopping, but changing the sensation someone feels. Okay. But we've just gotten to a point where we needed more. We needed to go further.
Yeah.
And I think this is outside the box, and I'm just really excited about it.
I'm excited for you and your patients, because, when we did have the technician, Chris, who works at your location, he came on earlier and he was telling some results from patients, and it's amazing what people are feeling and how it's changing. And, I've even had the benefit of the luck of having someone send me a text message and say, this is what I'm feeling.
Well, we're about 8 weeks into it, and patients are already reporting me that they've reduced pain medications by, the individual yesterday I was speaking to has at least reduced by one tablet a day of a pain medication after 2 months. And it just makes me so excited, and there's just no words.
Well, I'm blessed to be working with you, so
I appreciate that.
Do you have, I think we have one more here where we can just kind of show a change after doing the same things we're doing. This person was not a pain patient, but, this person obviously had a whole lot of anxiety, and over here it had been virtually eliminated. I always look at this because they have a little bit more delta. Delta can also be tired. So after somebody starts a vibrational program, this and that, a little bit tired, right? So we had to coach this individual up on, hey, how about protein? How about this?
Right.
Because, those are the things you start exercising.
Yeah.
So we have this, and I'm thankful that we're partnering together. What's the future look like for you? What's the future look like? What do you want to do with it? Where do you want to go?
I would really like to bring fitness and physicians together.
Sure.
So
expand.
That's
Come on,
something.
tell me. What does it look like?
Well, I would like to build a gym that encompasses that very statement.
Sure.
And just let people know that it's inside out. You have to work it from the inside out. And that means taking control of yourself and improving betterment and through exercise and so forth.
And you've lived it.
And I've lived it.
And I think gym, obviously, that fits you.
Yeah.
Yeah.
It's always something that I've had, obviously, in the back of my mind for several years.
Sure. And maybe even physicians coming together and banding together on this journey, because it's interesting. So how about your practice? What's the future look like for your practice?
Oh, well, I feel pretty solid about how we basically approach things from a physical perspective and interventional perspective. I take one step at a time, one day at a time. I'm looking right now ahead at this in our program that we're building together and seeing where that goes. And then we'll build further from that will be next step.
Sure. Maybe we can work together to get some other doctors involved in just the brain mapping part, because I think from a practice perspective, from a patient perspective, I think it's going to help.
Yeah.
I think it's the best shot we've got. And just real quick, when I was learning about the vibration platform, it was like, well, I can't stick a treadmill. I mean, you could stick a treadmill in there, but does it have the same impact as the vibration platform? I think so. And it doesn't.
No.
So we can't do that. So it's just like, hopefully we can take it to some other doctors together.
And the excellent thing about the vibration platform, it's also from a physiological perspective. Otherwise, you're even touching on the bone remodeling process of the body, older populations, osteoblasts, getting that going. It's and just basically strengthening all the stabilizer, tissues. It's good. Like I said, I'm very excited about it.
Well, I'm thankful. I love knowing you. It's only been 2 months. I look forward to our future hanging out. Thanks for coming here today.
Thank you.
I appreciate the interview. And thank you all for tuning in and listening to us. We'll catch you next time on Vigor Active Health Chats. Thank you.